hygiene and mobility, right? Mobility. So if you don't move, your patient don't move, what are the possible complications? Okay? List all that you know because it's coming up. Edema and grading of edema. What is your nursing intervention? No? We just discussed about earlier 1, 2, 3, 4, 2, 4, 6, 8. Okay? Oh. Those of you who we just took lunch and you BRB, you ask your classmates. I'm not gonna repeat. What is this? Number 5, know all these words. Okay, because you cannot answer this without knowing this medical term. Number 5, right? What do you discuss EMR? What do you use it for? What is it? Right? How do you assess a patient for the readiness in ambulating? Okay, how do you assess? List all that you know. Okay, apical pulse, location, everything about apical pulse. Okay. Abdominal assessment and checking for bowel sounds. This one, I want to explain this one. Let me see if I have. Let me open a slide. You can relate. Here. So guys, bowel sounds. What is the normal bowel sounds according to ATI? Because when you talk about bowel sounds, know everything about it. What is that? Is there a number? What's the sound? Am I expecting? You have your stethoscope, right? Practice on your family member. Don't just read the book, right? You practice. Oh, okay, this is what. Because guys, in your exam, they might be letting you hear a sound to identify that sound. You know that in NCLEX, you always know. Oh yeah, S1, S2, S1 lab, S2 dab. How does it sound? Huh? That's how you study, and please do not forget your rationale. So who can explain? Oh, wait. According to ATI, what is the normal range of bowel sounds? Remember?
To 5 seconds.
5 to what?
5 to 35 seconds. We have to.
Can you please tell us the page where you find it? Where you found it?
It was in the practice A.
Oh, I have the page, but yeah, just search on your own, okay? Thank you, Lillian. That's correct. 5 to 35 times per minute. Okay? You can count for what per minute. So 1 minute, no? So you gonna expect 5 to 35. So it's 6. It's okay. So it's within normal range, right? If you have count of a 25, it's still okay. Anything below 5 is abnormal, right? Slow. Anything above 35 is abnormal, is fast. If you want to, it says in the book, if you want to determine if the bowel sound is really absent, you have to listen for how many minutes? Just to make sure. How many minutes? How many minutes? When you don't hear vowel sounds, you're not just gonna call the doctor. Doctor, no vowel sounds. How many minutes to make sure?
Similar like listening for a heart rate is like for one full
1
minute.
minute?
I'm already counting for a minute for my normal. And what if,
To 7?
why don't you
5 to
search your
7.
book right now? Can you go to your book? I don't want to just say and tell and tell. What does it say in your book?
It says here, Miss Joyce, full 5 minutes.
Okay, thank you. Full 5 minutes, no? Just to make sure that you really don't hear anything. 5 minutes. And what is the only one, an unexpected sound that you hear? What's that word? I've seen it in your templates. I've seen it, guys. So expect that it will come up in your final exam. What is that word? That medical word? Okay, Andrew, thank you. Borborygmi. So please know that. Not only know that, how is it sound? Just when you have diarrhea, right? You don't need the stethoscope. You can hear your stomach growling, right? You don't even need. Okay? Hyperactive sounds is the borborygmi. Increased gastrointestinal motility, no? That's why when you have diarrhea, you cannot hold. You can have an accident, right? When you have diarrhea, you have to go number 2, like right away. Isn't it? Okay. Because it increase motility. So it's just keep on pushing. Okay? Okay. Good. Okay, so we know the range. How do we listen to it? I post this here.
We listen to it from where the ilium is.
Very good. Why ilium first? Where the ilium is. Not the ilium, but where the ilium is. Okay, that's good.
Right side.
You start in the cecum.
And the lower right quadrant.
Lower right. Okay, very good. Okay, then what's next?
The upper right quadrant.
The right upper. Okay, then left upper, then left lower. Why? Irrational.
That's how the intestine is located.
Okay, very good, no? That's why I shown you this picture. Okay, because this ileum is the last part of our small intestine, right? Ileum, ileocecal valve, remember? What's the function of a valve? We do have valves.
To
Prevent what?
coming back into the small intestine.
Okay, backflow, no? Okay. So, okay, cecum, ascending, right? Transverse, descending, sigmoid colon, rectal canal, and the anus. So you will auscultate first, right lower quadrant, then right lower quadrant, right upper quadrant. Okay? Okay. Even the masseuse. Is this the class who told me? The masseuse, if you're constipated, they will follow your large intestine for you to release that Is this the class or last cohort? So they gonna massage from here to here, just to push. Now, another important thing, guys. It says here, this is your rationale. Where is that rationale? For most body system, listen guys, I'm reading from ATI and you research your own. Where am I reading from? Follow the sequence of first, inspecting, palpating, percussion, auscultation. Take down notes. Anyway, it's in the ATI. Most body system, your heart, skin, musculoskeletal. Okay? It says here, inspect, palpate, percuss, auscultate. Remember that, please. In the exception of the abdomen, you're gonna do inspect, auscultate, percuss, and palpate. What is your rationale?
What do you mean, Miss Joyce?
Can you say it again? How is the order?
Okay. Again, take down notes. It's in your book in ATI. Search on it. For most body system, I should be in assessment, no? That's a tip. Follow the sequence of first inspecting, palpating, percussion, and auscultation. All system, Inspect, palpate, percuss, auscultate. In the exception in the abdomen, the sequence of your assessment is inspect, auscultate, percuss, and palpate. Why? Why is your rationale,
Because you have to check why is different. Are you asking why the one of the abdomen is different? Because
Yes.
you have to inspect the condition of the stomach. Either is swollen, you inspect with the eye, then you auscultate before you percuss, and the last one would be you percuss before you the last one, auscultate.
Percuss and palpate is the last two. Why? Why is it different with abdomen? Why is it not the same as all the systems?
You have
Give
to
you the
feel
options.
the
You give
drum,
options.
the air. If there's too much gas, you have to feel the sound of the gas, like if it's gas.
Not about gas, but thank you for trying. Jorge, there's no option. I just want to know why, the rationale.
Miss, can I
Does it
try?
have to do with, oh, I'm sorry.
Carla?
Does it have to do with the fact that you palpating first may alter your results afterwards?
Jan, thank you, my dear. Jan?
Well, I was gonna say that too, Miss, but because
It's correct.
you have to hear the vowel sounds first, because that would be the most accurate before you can palpate or percuss.
Both of you are correct, no? So you want to inspect first using your eyes, no touching. You auscultate. Because if you percuss first, especially if you palpate first, you will, like what you said, Carla, no? You will stimulate the motility of the stomach. Then what? You auscultate, you're counting your bowel sounds is increased. Because why? You stimulated that motility. Does everybody understand? Yeah.
Palpate is when they put their hand like this and they tap you on your abdomen like this.
Sorry, hold on. I cannot see you.
You know, sometimes the doctors put
That's
their hand-
percuss. That's
Oh,
percuss.
Oh, yeah, I see.
So,
that.
yeah. So it's like
Palpate, what is that?
Just
palpate
touch
is
when they touch.
Oh, okay.
So, right? They're gonna, okay, I'm gonna press here. So the doctor will first do a light palpation. There shouldn't be any tenderness, right? The doctor won't see you grimace or say, ouch, something's wrong. Right? First, the doctor will feel you, and then he's gonna say, okay, I'm gonna do a light palpation. I'm gonna press. Remember, we have to be late. I'm gonna lightly press on your stomach. Okay, tell me if it hurts, right? Then after that, to make it sure, the doctor will go harder, pressing it harder than the normal. Okay? So percast is this. Actually, guys, I asked the doctor in ATI, do we percast as a nurse? They said no. And it's also in the book, no? That is a practice of a higher, like an RNs, no? But we still have to know what is percussion. So it doesn't mean, oh, we don't do that. I don't have to know that. It's gonna be in your exam.
Thank you. I had it backwards, so now I know.
Okay? You're welcome. Okay, guys? So the percussion is like you're thumping a melon. See if you the melon is like if it's juicy or not, right? You will hear a different sound. Okay? If like let's say you have a liver cirrhosis or hepatomegaly, something. Okay? Do you understand now the abdomen? Okay? Hold on, let me. So, guys, when you study, you research on those, no? And please make this exam the highest, your highest score, no? Infection and expected lab work and ranges. Okay? If you have an infection going on, what do you expect would be your lab works, and what would the doctor be focusing on? Is it RBC, WBC, right? And your normal ranges.
Okay,
Right?
are they gonna specify what kind of infections it is? Because we have a lot of infections, like urinary infections, like inflammations by infection. So they're gonna specify everything?
It will be in a general infection. It's not gonna be like a parasite infection. I know that's in the anatomy. When you're fighting a parasite, what is increased?
WBC, white blood cells. Your
That's why
white blood count.
no, when you're fighting a parasite, remember? We just talked about it on Monday. Okay, so this is in general, yes, what type of WBC? Is it neutrophils, right?
Miss Joyce, Miss Joyce,
Neutrophils,
is WBC white blood counts?
white blood cell.
Cells.
Yeah, okay. So in general, no dose. Discuss manifestations of hypovolemia. So meaning, you always ask first, what is this hypovolemia? How do I get hypovolemia? What to expect when a person have a hypovolemia? Okay? Another one, urinary tract infection, we are familiar with UTI. No? UTI and your expected findings. Okay? Study those. I'm not gonna give answers anymore. You have to give me answers. Okay? Discuss Erickson's stages of psychosocial development. This is in your ATI book. Okay?
Can you explain? I'm sorry, Miss, but can you explain a little bit about the Erickson stages?
It's your psychosocial development. So Erickson is a theorist about this. Like if your ages 1 to 3 years old, okay, let me find this. This is hard for me to You have this,
I think we reviewed that in nutrition from the development of like 1 through 3, like
where's that?
what they develop, or like older adult,
Yeah.
the middle adults. Is it that?
Yes, correct. What page is that? Psychosocial development. This I had a hard time with in my college days. Like psychology. That Erickson. Like, what is your behavior? No? What is your behavior between ages this and this? And then when you get older, you have another.
I think it starts in health promotion.
Yeah. Why don't you, thank you, my dear. Why don't you find with me and let's discuss that?
It's in the ATI chapter 20 to 25, I believe.
20 to 21.
Actually, 19, it's starting 1 to 3 years.
Yeah, find it. Okay. See here, Erickson. Initiative versus guilt. If you're a preschooler, 3 to 6 years old. So let's just cite an example now. Let's start with the younger one. So we can relate. We have babies. Okay. 2 days to a year. Where is it? Where is this Erickson? Okay, here. Psychosocial development. 2 days to 1 year. Trust versus mistrust. I think you have this in didn't you have this in high school? Birth to 1 year. Infants trust that others will meet their feeding, comfort, stimulation, and caring needs. I experienced this with my daughter. Trust versus mistrust. When I tried to feed her with the bottle, I didn't know what do you call this? Do we call that the nipple? The nipple didn't have a hole. So she sucked and sucked and sucked and nothing comes out. Yeah, and then after that, when I try to feed her, she don't want anymore.
Oh.
Yeah. So that is trust versus mistrust, no? I was a new mother, no, I didn't know. Okay?
What page did you get that, Miss Joyce? Trust
What?
versus. On what page did you get trust versus
It's
mistrust?
in every stages. So I'm in
No, I mean
page
on what page on the ATI book?
94.
94. Okay. Thank you.
Yeah. So look at this, no, and you will relate to your children. Did this happen? Okay. Trust versus mistrust. Because guys, this Erickson, it affects what you are right now. Right?
Yes.
What we are right now. I think it starts at birth. Yeah. Stage 1. Yeah. Infant is 0 to the baby, 1 year, no? Then when you go farther, toddler, 1 to 3, Erickson. Autonomy versus shame and doubt. Independence is paramount as toddlers attempt to do everything for themselves. Isn't it? Can you relate, guys? You see your toddlers? Toddler meaning they start to toddle. Separation anxiety. Toddler might show regression Bedwetting, no? It's a sign of regression. Thumb sucking is a sign of regression. As a response to anxiety or separation. Good stuff, no, guys? Very good. You're gonna talk about this again in your psych next term 2. So you're gonna go deeper. So study this Erickson per stages, okay? Just a tip. We are talking about adults. So what kind of adult? I don't know. Middle adult, young adult, older adult, okay? Okay. Discuss what is rhonchi, crackles, wheezing, and friction drop. I think it is all in my slides here. Here. Okay. This is how you listen. You got this slide, right? This is how you listen. Zigzag, no? Zigzag, zigzag. Okay. Then these are your different lung sounds. Adventitious sounds, meaning it's not normal, right? This one, guys. Let's watch this.
We have access to those slides, right?
Yeah, I posted this.
Okay, thank you.
You're welcome. Let me know if you email me so I can. Oh, what happened?
The two basic types of adventitious or added breath sounds are the discontinuous sounds, crackles, and the continuous sounds, wheezes and rhonchi. Crackles are intermittent, non-musical, and brief, like dots in time. Fine crackles are soft, high-pitched, and very brief.
Do you hear the popping sound? Okay.
Coarse crackles are louder, lower-pitched, and longer. Compared to crackles, wheezes and rhonchi last much longer and sound more musical. Wheezes are relatively high-pitched and have a hissing or shrill quality. Rhonchi have a lower-pitched, snoring quality.
So, crackles or rayleigh, another name is rayleigh. It's wet and popping sounds. Now, okay, when you put your hair, it says in the book, right? When you rub your hair against your fingers, that's how it sounds, popping sound. Because why? What does it signify? This is usually at the base of the lungs, at the end of the inspiration. So you inspire, you're gonna hear it. What do you think it signifies?
Water in the alveoli.
What is called? What is when you have water in the lungs? What is that? What is that called?
Pneumonia.
Pneumonia, right? Okay. Okay. So, wheezes, continuous high-pitched squeaking. Sometimes you don't even need the stethoscope for it, right? Because your airways is constricted. That's why there's sound. High pitch. Asthma, right? Asthma. That's why they're having asthma because of the constricted airways. Okay, so please know all this. Ronchi, it's also continuous, right? Remember, wheezes and ronchi is both continuous. But this one is low pitch. And you can hear it. You can hear the sound in the trachea and the bronchi. Okay? And then it says here, it may be cleared with coughing. Right? Okay. High pitch stridor is another adventitious sounds. Larger airways blocked by a foreign body. Sounds like choking, right? But I don't have stridor and friction rub in the video. And friction rub is the scratching or squeaking sound. It cannot be cleared with coughing. So if you can find a friction rub, maybe it's in the ATI. You want to listen because it's coming up, no? Okay, it's coming up. Oh, let's answer this. Hold on, guys. Let me. Where is it? Won't get me. And I have Kahoots for this. I have Kahoots for this. This test. High pitch, squeaking sound. Asthma, wheezing, no? Wheezes. Okay, good. Okay, so let's see more of those. Ronchi, how to determine transfer from bed to wheelchair. What do you want to make sure of? Okay, tell me your answer next week. List all, no? List all that you know. Okay? Give examples of subjective and objective data. Laceration, contusion, abrasion, and puncture. Remember, I have that in this slide. We talk about those. We're gonna chart, guys. Uh, 60. Remember this? Kinds of wounds. Remember? Where is that? Then I have it in one of my, oh here. This one, guys, no? Anyway, this is in your Hooper book. I think it's also in your ATI book, but it's black and white. No, this one, no? What is an abrasion? What is an incision? Okay? Coming up. Okay. Choking. Guys, how do you know if I'm choking?
If
You
you're
can
Changing color of your
Dark
face.
purple.
You can't talk.
I cannot talk. If I say I'm okay.
You
I'm
are
really not
okay.
choking, no? I can cough it up, cough it out, whatever, you know. I cannot talk. Okay? What do you do with the if I'm choking? Just let me.
Permission.
asked if you need help.
Permission.
Okay, yes, because you always need a consent, no? Reina?
Oh, I was just gonna mention that in one of the questions that I had, it asked for the like what do you see when a person is choking. I think it was on a kid. And one of them was a flush in skin. And then the other option was unable to talk or cry. And I remember I thought they were all right. When I saw the rationale, the first one was you can't cry, which can be a very confusing question. So just putting it out there. So if you get that question, you know more.
You mean that's
Why?
in your practice?
I don't remember if it was on my practice or the dynamic quizzing.
It was in both practice A and practice B.
Oh, okay.
And dynamic quizzing too.
So be
I
careful,
thought-
ah. You know it's coming up, right?
My daughter was choking yesterday, and instead of her telling me that she's choking, she's looking at me, pointing with her finger to me and my food, like, eat your food, leave me alone. Like she was pointing at me like this, like, and I look at her, I said, what's wrong? And she's like, and then all of a sudden she got red, and I said, you choking, what do you tell me? And I smacked her in the back. And then finally she speed up the stuff, but like kids react different ways, you know. I never seen somebody choking and telling somebody just go mind your business. That's what she was telling me. That was crazy.
But she's okay, right?
Oh yeah, she's okay, but she was like,
Okay.
like pointing like, you eat.
Guys, so it came up. So it's gonna come up in your final exam too, no? So please be serious with your practice A and B. Okay. If you hit a level 2, even if your grade is 75, it will pull you up. So I advise you, I hope you get a level 2. A better is level 3. Good, huh? Okay. No pressure. Let's try. Okay, ingested poisoning is coming up, and what is your intervention? Okay. Aquathermia pad, what is this? Okay. What do you want to monitor? Okay. DNR, principles of DNR. So you have to go back because why you're gonna ask, why is DNR coming up again? It's because of the urgent care. Do you know, guys, if I didn't sign or the doctor didn't sign the DNR, my DNR, this is what I want you guys to be proactive with. The things that we are talking about in the theory. What is this DNR? What is a doctor's signature? Who else's signature is there? Huh? Okay, very good. If it's not signed by the doctor, it's not valid. But, okay, so if it's not signed and you still did the CPR, you go straight to jail. I'm sorry, just kidding. They might sue you for battery. So you know, guys, actually, when we have a code blue in room 310, code blue in room 310, all of us, licensed nurses, and even CNAs, no? Each of us know what to do already. Like Linda, two of you will be with the patient, okay? One is checking the chart. One is already calling 911. One is calling the doctor. One is minding the to clear the hallway because 911 is coming. So we all know. So even if you already saw me with the patient, you go to the chart. Or you already even you already saw Alisa in the chart, you go find yourself what to do. It's a teamwork. Okay? All right. So please know what are the principles of DNR. They usually, the pulse, they usually print it in a hot pink. Huh? Check the chart, guys, huh? Study those what we are talking about. Differentiate sprain and strain. What's the difference between these two? What is a sprain? When do I say it's a sprain? When do I say it's a strain? Anybody?
Is a strain like like you strain your muscle?
Very good. Overuse, right? Sprain. How about sprain? What is sprain? What do I sprain?
Ankle, wrist.
Ankle, wrist, yes. So the usual site is your ankle, no? Okay. So, and know what is your intervention for those two. Hypoxia. What is that? What? Know the early and late signs of hypoxia. Oh, is this a repeat? CPR and procedure? No. So CPR, when do you use CPR? What is CPR? When do you use CPR? What pulse if am I checking with the CPR? When I'm checking to see if I'm gonna give a CPR or not. Okay? How many compressions? Those are the things you want to know. Reina?
On the CPR questions, are they going to be related like what you showed us last time about the keywords of urgent, who to save or stuff like that? I think we saw a video of CPR, or was it CPR?
Follow the emergent, urgent.
Is it going to be related to that or no?
It's all CPR. Just know about CPR. When do you give CPR? To who? Okay. And the procedure. How do you do your CPR? How many compressions? How many breaths? Correct? Anaphylaxis and expected findings. Injected poisons and interventions. We talk all of this about this, no? What do you do with bleeding? Remember, there's 3, right? What's the first one you're gonna do? And then the second, if the, okay, what kind of pressure? Direct, indirect? Are you gonna do the, what do you call that? What's the one that is your last, tourniquet? Okay. ABC is coming up. Glasgow. Let me just discuss this real quick with the Glasgow. Okay. Here. Glasgow, guys. Okay. Glasgow is an assessment of a level of consciousness to know what is the severity of the trauma, okay, in the head, okay. So, see here, level of consciousness, okay. Level of orientation and responsiveness. So, you're gonna start with the eye. Okay? Eye first, guys, no? Spontaneous meaning I open my eyes, I close my eyes. You give me 4 points. Verbal stimuli, command speech. You have to tell me to close my eyes, or you're talking to me and I look at you. That's 3 points. Pain. And if you apply pain, no, not in the face, no, you don't pinch the face, okay? You usually pinch in the forearm, no? Okay? If I respond to that pain, eye opening, you pinch me, I look at you, or I open my eyes, give me 2 points. If there's non-response at all, you tried everything, there's no spontaneous, there's no response in your command, there's no response with your pain applied to my forearm, 1 point. Okay? Verbal response. Am I oriented? You're gonna ask my name, person, place, time, right? Give me 5 points. If I answer you back, but it's like a confused, I answer you in a confused way, but I can still answer your questions, give me 4 points. No? And then so on. No? Inappropriate words, 3. Incomprehensible speech, 2. Okay? Motor response. Can you please lift your arm? I'm obeying to your commands. Can you please bend your elbows? And I do it, 6. Okay? Purposeful movement to painful stimulus. Okay. You pinch me, I draw back, give me 5. Oh, I think that is the withdraw. Sounds the same, no? Withdraw in response to pain, 4. Flexion in response to pain, decorticate. Decorticate, decerebrate. Decorticate, decerebrate. That's how I learned it in I remember it in my college. When you pinch me, I flex. That's a decorticate posturing, 3 points. I extend to pain, 2. No response, 1. So, whatever score you put here, that is my score. According to the book in your Cooper, what is the normal? What is the normal Glasgow? So, I am not in a coma. It's a range. It's under physical assessment, please. Search for your answer, please. You found it. So what's the range in your Cooper?
Range of what? Sorry.
The range of your GCS, Glasgow coma score. Is in the Cooper.
The normal range is 15.
I'm sorry, what's huh? What who said? Can you please repeat? It's a range. 15 is not a range. Between what and what? Okay, stop it, guys. I can see your chat. Stop that. What? What's the range? No, look at the book, guys.
It's between a score of 8 or less indicates severe brain injury. No, that's not what we are
Okay.
looking for.
8 to 15, no? It's okay. 8 or less, meaning you have a severe brain injury. Severe brain injury. You see that in the page? What page do you have, Linda? Thank you.
Page 327.
Okay. Okay, take a break, guys. I'll see you 110. Okay.
Carla, can I have like your email, your number, so I can ask you for the information of the CPR, the one that you get that same day?
Yeah. Yeah.
Oh, yay, thank you.
Carla, can I ask you a question? For the ATI that I'm still working on my homework. Do we submit that to Miss Joyce? Did she say last time submit it to her?
Which API? Which one?
Or to John?
Which one?
Because I'm still behind on my ATI. I just been working on all of them. Actually, dynamic quizzes.
Oh, for the dynamic quizzes, you submit. For all of
Sure.
the other ATI stuff, you don't have to submit anything.
Or just
They
do
run
them.
they run a report and they check that you're doing it. So just
Oh,
make
okay,
sure that
okay.
you are doing it. But yeah, the ones that you have to submit is just your dynamic quizzing.
Okay, I thought the dynamic quizzing was due today at 11 a.m.
No, it's due
Oh,
tonight.
no, it's due tonight
Okay.
before 11:59. So do
So
it
make
sooner
sure you
rather
get
than later.
25 out of 25.
Yes. I got like
If you don't get
70 and
25,
I
do
was
it again and do it again until you do, because it'll count. All those points are gonna count.
golly, it took me 2 months to finally get the use of how ATI works, and it took me long, but I did it though. Finally, I already know how to check and what to look for.
It
Better
can be a
late
little
than never.
tricky, but yeah.
Yeah. Hopefully, gotta pass this term, and I'll be okay next term. Okay, thank you so much. I appreciate it.
So all the skill modules have to be completed already?
They don't have to be completed already. There's a couple that are still like due this week and next week, but after that, yeah, they need to be done.
Because
So
of the
it
clinical,
is
right?
gonna be the pre-test, an hour minimum clocked in on the lesson, and the post-test. And if you want to check to see, like if you started one and didn't finish it for any reason, you can go to ATI and there's a little tab at the top that says my results. You can go in there and you'll see that if you scroll towards the bottom, like it'll have all your test scores and then all your practice tests. And then all the way at the bottom, you're going to have all your skills modules and they should have a certificate. Like they give you a certificate when it's completed. So that's how you know you're done with that one.
But yesterday I was doing the ATI, right? And I spent like an hour and a half on the lecture. I did a pre-test, I did okay, and then I did an hour and a half on lecture, and then I did exam, and I'm still like at 88, 89. What am I missing it?
You don't have to, she said not to worry about that little thing that you see.
Man, I've been
That
going back and
percentage
forth.
thing, don't worry about that. As long as you did at least an hour of your lesson and you did your pre-test and your post-test, that's all you need. So if you go into your results, when you scroll all the way to the bottom, it'll show you all of your skills modules and it'll say, like, it'll have a little check mark for certificates on there.
I'm such a doofus, man. I swear to God, I went back trying to come up to 100%, and I spent hours and hours on the same one. Then I moved to the other one, doing the same bloody thing, and look at me, it's still behind those. Okay, now I know. Dang. Okay, thank you.
Ryan is the ATI expert, so you can always ask him too.
He's an expert on it?
Oh yeah, I will. I ask him. Really?
I
Yo,
think
Louise,
so.
we're
Yeah.
doing this today. That's what you want to do today, Louise?
So how do I get to 100%? So if I have 75%, I'm fine, right?
Yeah, as long as
As long as it's, those are the
Cool.
3 things that you need on your ATI. You don't have to worry, don't worry about the percentage that little thing has, because
All right.
it does it. It's for some crazy lesson timing number, but it's
Oh, okay.
75% has to be your post test.
Yes.
That is the minimum that you need on your post test.
Okay. Look at Ryan. He got his computer froze. The retake is today, right after class? For the ones that haven't taken the test?
I think, the fundamentals one
Yes.
is today. Yeah.
Oh, okay. Thank you.
Okay, we're back. Back. Okay, so injected poison, Glasgow coma scale. Review location of pulses. Remember, we are studying assessment, no? And you know that you have to compare pulses, right? Right and left, no? No different kinds of pulses. Again, these slides are a combination. I put it all together, combination of Cooper and ATI and nutrition. This is your pulses, no? This one, peripheral arteries, no? Meaning with your peripheral arteries, you have one of each, no? One in the right, one in the left, right? The only thing that is one is your apical pulse, no? Which is your true heartbeat. Remember, pulse is the recoil, the contraction and relaxation of our arteries. So it's not really the actual beating of our heart. Right? Remember, that's why I think in your one of your tests, if I'm taking medication, cardiac medications, if my pulses are irregular, you want to confirm by checking my apical pulse for a minute. Okay? So these are your grades of your pulse. Okay? Okay.
Do we need to include pulse deficit in any of that? Like, should we also learn up on that, brush up on that?
Yeah, because we're talking about pulse and assessment, right?
Ms. Joyce, please, can you go back to the apical, pulses, the true pulse, the one you just removed before the integument?
This one? Oh, no.
No.
Oh, where's that? Hold on, my dear. Let me just go back. Here. So 0 is absent. 1 plus is weaker. I'm sorry, weaker than expected. 2 is brisk. I don't know how to palpate for a brisk. Anybody wants to comment on that? Brisk. Okay. Bounding is palpitates. It's like you have too much. You are having too much fluid in your blood, no? Okay. Symmetric in quality and quantity. So you have to know how to differentiate, no? It has to be symmetric. Unless you have an artery disease, right? PAD, peripheral artery disease. Of course, you don't expect to be the same, but that's why you are comparing both pulses to know. Then you notice something, okay, right is increased than the left. When you have those unusual assessments, what's the first thing you do?
You double check again.
Thank you, Catherine. Double check before calling the doctor. You got a tachycardia, bradycardia, double check again. You got a high blood pressure or high or low blood pressure, blood sugar, anything that is abnormal. No? You want to recheck before alarming, not even the doctor, like your supervisor, you have to report to your supervisor, right? And then the doctor. Okay? Location, different kinds of pulses. Okay. So know all those, no? Know these key terms. Now I want to explain to you the kyphosis and lordosis. Where does kyphosis happen and where in the cervical spine? Where in the spine? Not cervical spine. Where in the spine? Look at the spine here. Where is kyphosis happening and where is lordosis happening? We discussed about this already, right?
One is on the vertical and one is on the lumbar part.
Okay, which one is in the lumbar? Which one is in the?
It's lordosis because it gives
Uh-huh.
it gives the sort of king like view to your like your shoulder, so you're like positioning. So it's like royalty essentially. That's why it's called lordosis, like lord something.
That posture?
Yeah.
Okay. Okay, Carla, you're on the right track, no? Give me some example of a person who has lordosis. I know you said royalty, but what else? Maybe we don't understand all those. I didn't understand those. That's why you said it's.
What was the question, Miss? What is her doses? What is that?
Isn't lordosis like curvature of the lumbar region?
But it said lordosis with an L?
Yes.
Oh, okay, okay.
On what page is that?
Lord, like a lord king would be, I guess. Like that's your
Is
lord.
that
Yeah.
Chapter 16. Is
Oh,
it
give me an example of a lordotic posture.
Like
What
a
might
duck?
be
Like when your butt's popping out, no? Like
it's a duck.
a duck? Let me show you a picture.
It's basically what they tell you not to do when you're doing a plank. Like if you're holding a plank, you're not supposed to lower your butt. Sort of that way. I don't know if that makes sense to anybody.
It doesn't for me because I don't know what to.
I'm trying
do
to
with the
imagine what you're
plank.
saying, but I can't get it on my head.
Scoliosis.
No, no scoliosis.
I cannot find. Hold on.
She's saying when you lay down,
Please,
right?
on what page?
Carla?
Is it 16?
Right where I have it. That's
Carla, please, we are on what page?
Oh, what is that?
lordosis. Where it has
Doesn't that happen usually when like someone's pregnant?
Yes, that's what I'm trying to get. Pregnant or a soldier, right? Have you seen the stance of a soldier? Right?
Yes.
It's too like exaggerated, no? Lordosis in a pregnant lady is normal because if I'm pregnant and I have my big belly, right?
You
The
gotta
reason why
hold it.
it's to compensate with my big belly, I'm gonna have lordosis. Does it make sense?
Mm-hmm.
I want to show you a picture.
Let's say that lordosis just happened for pregnant women, because I've seen some guys and women that they do that too, but I'm not sure if they want to exaggerate that or it's because they have any like disc problems or back pain.
No, you're right. No, you're right. Here. Let me see. It's not only, I'm not saying it's only on the, we can see in the pregnant women and the soldiers. See here? Yeah. Even if you're not pregnant, some people, I've seen this too. And it's excessive. When our spine, lumbar spine is like this, have to be, look at their excessive curvature, right? And remember, lordosis only happens in the lumbar spine. Lordosis, lumbar. L and L. Now let's talk about kyphosis. Where does it happen in the spine? Look at the, no, it should be normal, the gray one, right? Okay. So where is it happening? Kyphosis.
In the thoracic region.
Very good. Okay. It will only happen in the thoracic.
Thoracic.
Okay.
Did you say thoracic?
Thoracic, thorax, thorax,
Oh,
T-H.
okay.
Yes, okay. Are we clear with the difference between these two? Now let's see scoliosis. Okay. Scoliosis. Now, scoliosis, guys, is an S shape or a C shape. See this one? Is an S shape. You see the gray area that has to be straight. Our spine has to be straight. This lady have an S shape. Sometimes it's C, but usually that I see is S shape. And if I have scoliosis, where is the curvature in the thoracic? That is where my shoulder is higher. So,
Miss Joyce,
guys,
on my x-ray, they did the x-ray the other day, and I have a scoliosis right below, close to the, above the coccyx right there. And I went to therapy for 3 months and it wasn't doing anything. So I saw the chiropractor next to this place. I went in, I paid $125, and I did 2 appointments with this guy. And he told me that my shoulder was just like that. So he did the first treatment. And on the second treatment, he told me that my scoliosis kind of went straight. So my shoulder is even now. And my pain went away a little bit. Not that much, but it went away a lot.
Good chiropractor, huh?
Yes. Yeah.
There you go, guys. It's not always the doctors, no. Sometimes, well, chiropractor is a doctor. Yeah. That's why, guys, no, we are, that I know Americans now are switching, not really switching, but having help from chiropractor, acupuncturist, right? Okay, yeah. Guys, by the way, we talked about sacrum earlier. This is your sacrum. Okay, this is your sacrum. That your tailbone is your coccyx. Okay.
Miss Joyce, is the sacrum a flat bone?
I would say so. It's a flat bone. This is an irregular bone. The bones in your wrist is irregular. So, but this is a flat bone, yes. The hip bone is a flat bone. Okay? Okay. Guys, know the difference, And look at this, Okay. Look at this. You think it will affect your breathing? When you have scoliosis, look at this. No? S shape.
Yes.
You
it
will
affect the breathing.
Yeah, it will affect your breathing, yes. And in the book, it says, guys, that it usually happens in a 9-year-old. It starts in a 9-year-old girl, okay, with no known cause. No? That's why, guys, we encourage our kids to join in a sports because makes their bones healthy. No? Okay, what else? Urticaria, just know this. Yep, that's it, no, guys? All of you have this, right? All of you have those, okay. Any questions?
Miss Joyce, we only touch the kyphosis and the lordosis and scoliosis. What about ankylosis? The ANKYLO. Yeah.
Okay.
I don't know.
We have to do our own research, and then we'll go over everything when we do the actual review next week.
Yes. Thank you.
Okay.
Because it will help you more. No, I'm showing you some because I have some pictures. No? That's it, no, for today. That's it for today. Tomorrow, 7 to 3. Don't be late. The checking of, oh, never mind. That's it. The pitting edema, guys, we have a picture in page 334. You still don't understand the pitting edema, okay? Any questions? That's it, no? Know your cranial nerves, huh? That's it. So next week, our topic will be oxygenation. Oxygenation, okay? Next week, 9th week. Okay. Oxygenation is not too long. So I think we can start with elimination after oxygenation. Both of those are not too long. Oh my gosh. 8 weeks, 9, 10, 11, 12, 5 more weeks and you're in term 2. Okay. So relax. Again, guys, I have Kahoots for this. Huh? Want to practice a little bit of.
Ms. Jimenez, how many questions is the final gonna be for fundamentals?
What's in the practice? 60, right?
So 60 on the final?
60, yes.
Dang.
I know, anatomy. Anatomy, it's 70. Nutrition, you only have 1 finals in nutrition. Somebody asked me earlier, is the test 3 grade for your presentation? Okay?
Oh, yeah.
So you actually don't have a test 3. It's for your presentation. Guys, if you don't present, you have a 0.
Oh, so we just have 3. We have the dosages, the anatomy, and fundamentals.
Yes, times 2. Dosage times 1. You have a retake for dosage.
Thank you.
But you don't need to do the retake if you pass the first time.
Yeah,
correct?
of course.
Okay.
Oh, okay. Glad you mentioned that. Reina, I will, I cannot put your grades yet because remember, every week I have a report. I report your grades every week in the admin. Okay, so please, anatomy, test 5. I'm gonna put it until the end. Nutrition until the end. What is ATI, the 170 points until the end. I cannot just put it.
I have a question.
Hold on, my dear. Hold on for your question, my dear. Hold on. Luis, can I have your question again? I'm sorry.
No, it was if we pass the dosage calc the first time, we don't have to do the second one.
Okay, I told you, no, that's a very good question. Now, let's just say, Luis, you had a 75. You pass, right? And you want to improve your grade, I will let you take it.
Okay.
Okay.
So the dosage
Not only you.
calculation is different from the other testing as to where, like, if you retake it and you get a better score, that score can be replaced. Got it.
You have 100 already and you want to practice more, why not? Anything that can help you learn. I'm up for it.
But Carla, you gotta have a lot of teaspoons in it.
Whatever is in your online practice, that's the preview. That's it. Hold on. Yes, the highest. We will get the highest. Catherine, my dear, thank you for your patience.
For all final tests that we're gonna have, are we gonna receive like a guide to study because it's a lot? Or do you recommend us to do something to study and improve the things that we catch and the things that we didn't? Are we gonna like have a review or not?
Okay, for the ATI, I can review you the past exam from the past cohorts. Now your final FON, it is from week 1. So if you haven't been studying since week 1, it's hard, no? So you still have time. You can still do it. From week 1, guys, it's gonna throw you questions from week 1. You might see a repeat questions. That's why, guys, I always tell you from the beginning, study, study, study. Finals are difficult or challenging. Okay. You still have time, guys. I would suggest practice your dynamic quizzing. Yes, Sylvia.
How do we know if we can take exam B?
You can take it now.
Oh, okay.
Yes.
All right, thanks.
Carla, I got your message, yes. When after my questions here. Okay. For your online, for your final ATI, you only have one chance to retake. If you already got a level 2, you are not mandated to retake 2 or 3. If you got a below level 1 or level 1, you are mandated to retake. And you will review with Mr. Topper. Okay?
Miss Joyce,
You
honestly,
need to.
I don't understand what you're talking about. Please, can you tell me one more time?
Let's say you have a level 1 and I'm pulling up the information about that.
Level 1 on what?
In your final exam. Hold on, my
Oh.
dear. Let me just pull out so it's easier for me to explain. Here. Okay, listen, So, this is your, and I'm gonna post this in Canvas. So, here is your ranges. So, look at this. Below level 1, if you scored 0, nobody scored 0, to 46.7. It's like a regular exam that when you're done, it will show you your percentage. It's not gonna say level 1. Okay? So, I'm gonna post this, in Canvas. So, this is your ranges for, you don't want to go here. No, because you fail. Unless your grade is in the 90s, but in term 2, you will be on probation. Below level 1 is not so good, So, you get 90 points out of 180. So, what is that? 50%. Isn't it it's gonna pull down your grade? Level 1, this is your range. See? 48.3 to 65. You got 135 over 180. 75. So if you're already at 75, you fail. Telling you guys. Oh, I didn't mention, sorry guys. Okay, when you are at below level 1, your practice focus review time should be 4 hours. If it's less than 4 hours, minus. I minus 5 every time you don't follow the instructions. You have to learn how to follow instructions. Level 1, minimum 3 hours. Okay? Level 2, this is what you aim for. That is your range, 66.7 to 83.3. So 150 divided by 180, you get 83. It's gonna pull up your grade. Even if you're failing, I think it's gonna pull up your grade, no? So that's your aim. And level 3, wow, 85 to 100. Now, last cohort, I have 3, level 3. Okay, very good. So it's possible, guys, no? No pressure, but aim level 3. You're still gonna do template minimum 1 hour. So all of you will do template. You only have a week to do your template. And believe me, guys, if you don't submit this, I'm not gonna let you take the final exam. You fail already. You can ask the students. Okay? So don't play with ATI, guys. Be serious, no? I'm gonna post this. If you're confused, let me know right away. Okay? Don't let me know when it's time for submission. That's a little shady of you. Okay? I'm gonna post this later. Question? Submit on Canvas, yes. If you submit via email, minus.
Miss Jimenez, can you please explain one more time about study guide for the terms? You said it's a first test, first study?
Study all your study guides for the final. All the study guides that we've done up
Oh,
until
whatever
now,
they-
study all of them for your final. That's your study guide.
That's it?
Because
Oh,
you're gonna have, maybe you're gonna have repeat questions. Start from week 1, yeah.
Oh, okay, yeah.
Yeah, okay?
Okay, Carla.
You can do this. You know what you know what my students do before? They study group. Because what might Vanessa know, maybe Jacqueline doesn't know, and vice versa. You know, that's what they do, and it's effective. It's effective. Okay. Anyway, we're going back to campus, no? So you can do your groups there. Please, I encourage you, don't stay in term 1. No good. No? You have to move on. All of you have to move on to term 2. And I wish you all the luck. If there's no, Raymar, you're awake now, huh? Earlier, I saw you sleeping.
All right, so for the questions on the ATI generated, it's like the ones on like your Kahoot and like the study guide and like Evolve, stuff like that, right? All right. Thank you.
You're welcome, Raymar. Anything else? I just have a short meeting. I have to be in the breakout room. Anything? No? Okay. You got this, guys, no? I believe in you. Okay. Mr. Topper is a good tutor, no? If you need tutoring. Let me show you the exam. Hold on, our meeting. Let me just show you this.
Preview.